you know. So we have the glitter of AI on top, and then everything works, you know. I wish that would be the case, but honestly speaking, if the underlying technology and the science doesn't work, then AI doesn't really help.
G'day and welcome back to another T1Dialogues interview with your hosts, myself, Jackson, and Pete. And today we're, questioning Derek Brandt. Pete, do you want to take it away?
Yeah, thanks, Jackson, and welcome back, everybody. So I'm really excited today, actually. We're interviewing a guy called Derek Brandt. I'm going to give you a little bit of a bio, and then you can fill in the gaps for me, Derek. Person with T1D, entrepreneur, CEO of the Global Center for Technology Innovation in Diabetes, aka DCB, aka the Diabetes Center Bern, investment committee member for Swiss Diabetes Venture Fund. I actually did go through your LinkedIn profile, and there's a bit of a gap. I can see your education, and I can see, I think, back to a little while ago, but there seems to be a little bit of a gap there. Do you want to kind of, is there anything that you think is pertinent or relevant for the listeners in terms of your bio and that little gap that's in your career in LinkedIn?
Well, yeah, maybe. There's something interesting for the audience. I was heading a medical device company for approximately 11 years, and we developed pumps. It was pumps to infuse drugs, and of course, one of the big projects was in the diabetes space. And so we developed a very sophisticated patch pump together with Sanofi and Verily, so Google Life Sciences. And 2018, I sold the company for 350 million euro, which was one of the biggest medtech deals in Europe that year. So maybe that's interesting because it's not, you know, when I talk about development of medical devices, it's not just pure theory. It's I got a kind of a background in that space as well.
Wow.
Maybe
yeah.
that helps you in that's part of my gap in my bio. Sorry for that one.
It actually leads in nicely to the next question. So you've got diabetes, and currently and previously you've got a career that's to a certain extent been built in the diabetes space, right? So you have in many ways benefited from having diabetes. Are you grateful given what diabetes has given you from a career perspective? I like to think of it as like making lemonade from lemons. What are your thoughts on that perspective or that question, Derek?
I was just laughing when you said grateful. I'm not sure if I'm grateful that I'm a type 1. That's maybe a little bit too far to the extreme. But of course, let's put it that way. It helped me in the university, you know, because I focused on let's say on pharmacology and topics like that, and that of course, and then I was always, you know, that was always kind of related to, you know, insulin secretion and so on. And then later on when I worked in the industry, of course, it helps when you are a person with type 1 diabetes. You have a complete different view on things, you know. And the big thing for me is always, you know, I live with type 1 diabetes, but this does not completely dictate my daily life. And I think that's the important element here, that you live with it, you know. It's part of my, I don't know if that's correct in English, journey. But it's not hindering me to do what I want to do.
So you're saying that diabetes maybe help you niche down when you were coming out of university or even in university?
Yes, of course. I started with chemistry, and then I realized, well, that's not enough for me to really understand diabetes. So I continued with statistics and afterwards pharmacology. So, and then I got a better overview and better understanding. And now for me, it's also clear that, you know, people living with type 1 diabetes, especially when you're newly diagnosed, it's really hard to understand how the insulin action works. Why is it 5 hours that the insulin works when you after injection? How does it work with basal insulin and so on? So I realize now that you need a lot of training and you need a lot of simple education, especially at the beginning, so that the newly diagnosed are not totally overwhelmed with information.
Yeah, it sounds like you've really carved out your journey through questioning diabetes and improving upon it. I must ask, when were you diagnosed? I'd love to know about what was that for you to create a career out of it.
I was just finishing school, passing over to university. That's when I was diagnosed with type 1 diabetes. And that was after an infection. The classical thing, had an infection, and then a couple of days later, my mother actually realized that I was sleeping even longer than as a normal teenager, and I was drinking 5, 6, 7 liters of water a day. And then she said, "No, it's enough. You go to see the doctor and check the glucose." And an hour later, I was in the hospital. So the classical, I think that's rather the classical way. But I always wanted to go into the direction of natural sciences. So that was not, that I completely shifted and, turned around and got a different way. And then I just focused a little bit more so that to better understand, my condition. I wouldn't call it disease, actually.
And so the transition from scientist to entrepreneur to businessman, tell us about that journey. Was there a moment where you woke up and when I don't want to be a scientist, I want to be an entrepreneur?
The thing is, actually, there's another gap in my bio. I met my wife while I was studying. And, and then after I decided to go for pharmacology, and then she said, now, you passed pharmacology, and now it's time to make some money. It's enough university now. And so, and she had already a good job in the pharmaceutical industry in Basel, in Switzerland. So then I decided to found my first company directly out of university, which was a clinical research organization. So we did a lot of clinical studies for the pharmaceutical industry, tested new drugs for the pharmaceutical industry with healthy volunteers. And we grew the company to, 48 intensive care beds, about 150 people staff, and I did something like 200 studies in that space, testing new drugs mainly for the big pharmaceutical companies. So I'm not allowed to talk officially about the different drugs, but we had a drug, the outside of the pill was blue, without naming exactly what pill it is, but I think a lot of men should know this one. And and that was for cardiovascular. And then our study nurses came back after a while and said, "Jesus, we have side effects." So that was actually when the company decided to switch over from cardiovascular, a main focus of the drug for cardiovascular to do you call this man's disease in English?
Maybe. We understand what you're saying.
I don't know what man's disease is.
You're not old enough, Jackson.
But yeah,
Jackson, maybe you're too young for that one.
That's enough information. Yep, I get it.
So the entrepreneur's always been in you.
I directly started as an entrepreneur. Let's put it that way.
Was it part of your DNA then? So were you entrepreneurial? Was that were there other signs of the entrepreneurialness before that?
I think maybe I realized that maybe it's the best for everybody if I'm an entrepreneur, because I don't know if a boss would be able to handle me. So let's put it that way.
I can relate to that. So on to DCB. We're curious about the origins of DCB. I think our listeners would be really curious to hear more about DCB. It was founded in 2017. You joined in 2019. Tell us a bit about DCB, about the changes, but also what it was at the beginning and what it is now and how it's got to where it is.
So the origin of the Diabetes Center in Bern as a foundation, so it's a non-profit organization. I think that's very important to know. was actually, there's a guy in Switzerland called Willy Michel, and he was the founder of a company called Disetronic a long time ago. And what they did is actually they invented a new pump technology, and he was very successful. I think that's the most sold pump in Europe. Big success. And then he sold this company a couple of years later to a company called Roche in Switzerland for more than 1 billion Swiss francs. And then he started a new company, and the new company is called Ipsomed, still exists, and they are developing pen systems. They now also have a line of pumps, infusion catheter-based pump, and so on. So he was an extremely successful entrepreneur, and that's public, he's a billionaire. And then he decided, because he did these two companies based on diabetes, so he decided to give something back, and therefore he donated a significant amount of money into the foundation, Diabetes Center Bern, so that we can focus on diabetes technology and help startup companies, innovators, and also researchers to bring their new ideas, their innovations forward, so that we can see a positive impact for people living with diabetes, hopefully in a couple of years. And we all do this, as a non-profit. So we are not interested in making tons of money with those startups. We just want to help them either through a little bit of money. We have this innovation challenge, Pete, you know that very well. We have other ways of just coaching, supporting them, maybe helping them to find the right partners, helping with a network, whatever the startup needs. That's what we try to help them with. So we also have, for example, a clinical team, and the clinical team helps them to run efficiently the clinical trials they need for their registration purposes. So all this is the Diabetes Center Bern, and the whole organization is designed and set up in a way to support innovators. And the only vision we have is we want to see an impact for people living with diabetes. Hopefully we helped a little bit to make that happen. That's all. Very simple.
That's awesome. That's very exciting. And I was just wondering, do you love seeing new technologies coming out? Do you love and even helping out these new technologies that can really assist with the diabetes community?
Yeah, but some I see it and say that's great. But others, I have to say, after having seen, 200 non-invasive glucose monitors in my life. And, if you see the 6 or 7 times the same kind of technology trying to come in, and now, they all come and say, yeah, we use no technology, but now we use AI, so we have the glitter of AI on top, and then everything works, Well, I wish that would be the case, but honestly speaking, if the underlying technology and the science doesn't work, then AI doesn't really help. So, but I can give you maybe an example of something, and it's public, so that's why I can talk about it. There is a small company from Finland, really small company, and they said, you know what, we developed a wristband, and that can detect hypoglycemia. I said, yeah, sure. And then I said, okay, you know what? Send it to me. Yeah, I'll check out. So they sent it to me, and then, of course, as a person living with type 1 diabetes, I ran into hypoglycemia. And then actually I sent the data back to this Finnish team, and then I told them, look, can you tell me when I was in a hypo? And they told me plus minus 5 minutes exactly when I was in the hypo.
Oh, wow. That's really impressive.
Yeah. And so it's a wristband, but no contact to the body. So no invasion or any needle, nothing like that. And then
just like a watch.
Yeah. Well, yeah, even simpler. And then I asked, what is it? And I said, well, it's a gas sensor. I said, what? Yeah, we are, in Finland, you have these diabetic dogs, which can smell whatever. Diabetes, and then we thought we use a gas sensor and do the same like the dog does, and so they have just a simple gas sensor, and they measure the change of, it's called volatile organic compound, so the exhaling and through the skin the change of a person living with diabetes while going into hypoglycemia.
That's super exciting.
And now we are running a clinical study in our facilities to scientifically show that this is possible. And very simple, very, very small company with a brilliant idea. And just think about it, maybe it's not for all the people having a CGM system, maybe that's not so super relevant. But when you think about, people in an elderly home, yeah, or, they just have a wristband and you just have to recharge it from time to time, but that's about it. And then when you're running low, it just starts to beep and blink, and then, people know, okay, now I have to measure glucose and take a little bit care of this person. I like that.
That's super exciting.
Yeah. So that's it. And then you can really feel now that I'm, I like this kind of projects, Another project, give you another example, and then you understand a little bit, comes from the research side. Our partners from the University Hospital in Bern, they said, you know what, when you drive a modern car, sometimes the car, it tells you, hey, I think you're tired, you should have a break. Maybe you have seen this already in a car. Yeah. So, and the reason why they can do it, they have different sensors in the car which detect your eye movement and how you turn the steering wheel and, and so on. And then we ask ourselves, well, is it possible to use the same sensors to detect hypoglycemia? So we set up a drive simulator in our environment, and then we had people with type 1 diabetes in a controlled clinical trial. We had IV lines, insulin and glucose infusion, and then they were driving in the drive simulator, and then we ran them low, down to 3 millimoles, which is, 55 or so. So you feel it. And then we wanted to see if that changes, their driving ability, and if the sensors would be able to detect. And they were able to detect, and the sensors were able to detect hypoglycemia. And then we asked, okay, this is a drive simulator. Let's see how that looks in reality. So, we got a car. The type 1 was in the driver's seat. On the right side was a driving instructor. Second row were 2 physicians. And the third row was a technician from the Federal Institute of Technology. And then we drove, not on the normal road, but on a tank track in Switzerland. And they ran the type 1s into hypoglycemia and wanted to see if in a real car while really driving that changes and the sensors would be able to detect hypoglycemia. And I can tell you, yes, they do. So the existing sensors in a modern car are able to detect hypoglycemia. So you would just need to change the software in the car and say, I'm a person living with diabetes. And then the system could warn you and could tell you, hey, maybe you should check your blood glucose.
Wow. What a research. That's cutting edge research in diabetes blood glucose. That's great.
Yes, it's super great. Cool.
So that, see, and this is the kind, and so I'm not I'm not the CEO of the company. I live that, and I really, it's so intriguing and so inspiring to do this kind of work. And then hopefully in the future we have in different fields of diabetes technology, we have some features which help in the daily life.
Yeah, fantastic. That's very exciting.
You've touched on 2 technologies just now, both kind of like somewhat reactive, right? In terms of how they can make a difference in the world of diabetes. They're wearable focused or kind of like sensor focused, meaning that they're picking up something and like delivering you a message to help you change or to avoid hypoglycemia, for example. I'm curious about your perspective on, and you touched on AI earlier, and I thought the glitter thing was a great analogy. So if we think about those 2 technologies, which are quite, somewhat reactive, right? They're helping to prevent almost an acute scenario from occurring. But if we think about where we want to head, right, which is ultimately large scale population behavior change. And if we think about that as a challenge, even with CGM and all of the investment in technology and in science and what we know about diabetes, and if we think about AI and all the businesses that are out there at the moment, given where you sit and what you see, I'm just curious on your perspective on that challenge and what's happening out there in the world to try and address it?
Yeah, it's well. The first thing is I'm not sure if we should work too much on behavioral changes of people living with diabetes, because I mean, per definition, they have they have to make a lot of decisions, so that every day they work with and they live with diabetes, and everybody is on a permanent diet, and I don't think it's right for us to push and tell people how to better act and on a daily basis, but having tools and supporting tools which help them to live their normal life.
So assistance, not
Instead of telling them how to, existence, instead of telling them that's the way you have to live. So we need to have tools in place which just help you to go and live your normal life. And I think that's what we should focus on. Yeah, and I don't want to push everybody into going into low carb diets or becoming vegan or whatever it is, because that might have a slightly positive effect on your long term condition. Better have tools which help you to go and live your life, the normal life. Yeah, be part of. Yeah.
I like that. I like that a lot. I think assistance is always welcome, but like commands, maybe not so much.
Derek, AI, just your perspective on AI and what you're seeing out there, and whether it's, it is what it's cracked up to be. Is it it's making a difference in a looping perspective and in a insulin dosing perspective, but is it making a difference? Are we going to see in 50 years that AI is what's going to drive the next big improvement in diabetes outcomes?
Well, the first thing I think what people need to realize when it comes to AI only works with a lot of data. So what that means is actually you need to collect a lot of data, and then AI is really in a position to help you. If you don't have all the data, or a very small set of data, then it's difficult. So the first thing what we have to do is we have to come up and see how can we collect the data in a clever way, and how can we merge the data from the various technologies in one repository, one central place, so that you have your glucose data, your insulin dosing data, your eating habits, eating information, carb information, your activity and heart rate, and all this information need to be in one place, in one database. And you need a lot of those data. And then the AI has the chance and the potential to really help you, because then the system can analyze your habits, the way you inject and the way you act, and then it can really be an advantage, But I always come up with this example, when you drive on a regular motorway in Switzerland, so it's very boring, 120 kilometers an hour, all going the same direction, and you have a Tesla, yeah, and you push this auto mode button, the thing will just drive, and you can sleep, and that's actually no problem, yeah. But I'm not sure if you know the situation in Italy, in Naples. Yeah, try with an Tesla to go through Naples in an auto mode. You will not be able to pass the first roundabout. Yeah, because nobody is following rules and regulations in Naples.
Right.
So what I wanted to say is, this is exactly for me the picture of which we have to face. Under normal circumstances, if you live your daily life in an office and you have your, if you eat the food you eat, which you're used to, that is all easy, and then a fully automatic system can take over. That's no problem. And then suddenly, I don't know, something weird happens. You get a phone call and a relative, maybe it's a hard thing, but dies. What happens to your glucose? Yeah, and you have 50% chance that it goes up like crazy, and you have 50% chance that it goes low like crazy. And you cannot predict. And that's what I wanted to say. So all these systems, they help you in 98% of the cases. But you need to be in the driver's seat for these 2%. And to be in the driver's seat for the 2%, you need to understand the other 98%. Yeah, you need to know how to inject insulin. You need to know how to handle syringes. You need to still understand all the basic stuff. If you're not, and you need to be able to listen to your body. So what, for example, I had a training at the beginning, and the physician always told me, look, before you measure glucose, think about it, listen to your body, and tell me what your glucose level is. And I did this for a couple of years, yeah. And now I already got I think, rather good feeling, how warm my hands are, if I'm sweating. All this helps me to, maybe not totally precise, but I know roughly where I am. And this you cannot, you have to learn this. You have to understand your disease, because there will be situations where you have to be in the driver's seat.
So a robot will not take over our management completely, because we need to, like you said, with the driving through Naples, we'll need to grab the wheel every now and then.
Yeah.
I think that was very well put. So in saying all that, and technology and all these inspiring stories with management with diabetes, what therefore looks like a cure for you?
Of course, as a person with type 1, I would love to see a cure.
So a one-stop shop where we take a pill, maybe a little blue pill, and then the pancreas kicks off.
I'm not sure if the blue pill is the right one, but yeah, the thing is, or having implant a little kind of tube or something, and then you have islet cells in that one, and the islet cells will take over and then produce the insulin and will automatically control your glucose levels. So that's the vision of all those working on genetically modified islet cells, for example. But I've been in conferences on this islet cell topic for the last, 20 years or so, and they are still talking, and I have not seen a real solution which really works out there. There are some, I know that JDRF in the US and they are supporting projects in that area. But still, at the moment, it's the fact that you would need to take immune suppression drugs to avoid that the body kills the islet cells. And for me, honestly, at the moment, I'd rather take insulin every day 5-6 times before I start to take immune suppressive drugs, because that is just much more dangerous and much more side effects than injecting insulin.
Yeah, that's the one.
Yeah.
Can you hear me? This last question, then we're going to sign off. So the vaccines, right? So we've talked a little bit about potential cure here, Derek. Do you have any comment on the...
I didn't really get the question. Sorry.
Try that one again, Pete.
Is it my audio?
I think it's your Wi-Fi.
Yeah, it could be the Wi-Fi. Maybe Jackson, maybe you ask the last question and we can sign off. My apologies for the technology problems.
The last question we have is, I'm not sure where the vaccines were going, but if we look at pump technology, it's been 50 years since the first pump and 24 years since the first CGM. So looking forward to the next 25, maybe 50 years, what is your predictions for diabetes treatment with technology? Yeah.
So, there is a group in Graz in Austria, and they did studies at the Oneum research, and they showed that actually you can measure glucose at the same spot where you infuse insulin. So I'm very unscientific here. So that means it's no problem to have a needle, which you can infuse the insulin into the body, and at that same spot you can measure glucose.
So you'd shoot up, and then you could test
Yeah.
glucose, same spot immediately.
Yep.
That's interesting.
You might have to wait 5 minutes or so, but that's about it. But I mean, 5 minutes is not a big deal. But before you inject the insulin, you have a very good signal. So what I want to, so in the future, I think what we will see is actually the merging or the combination of a glucose sensor and a patch pump in one device. So you just have one patch on the body, and that is responsible to infuse the insulin and measure the glucose concentration at the same time.
It does sound like that's where we're going, because why have a couple of devices when you can have an all-in-one?
Yes. The only challenge is the current glucose sensors you change every, 10 to 14 days? And the patch pump you have to change every 3 days. I personally think that the combination and the merging of CGM and pump technology, that's a thing you will see in the near future.
Yeah, fantastic. So, Pete, were you there for that?
No.
Nope.
But I look forward.
We'll save. You'll have to listen to the podcast to hear that answer.
Exactly.
I look forward to it. Am I now better? Is my connection better?
All right, now speak, Pete.
Derek, thank you. Let's just say that. Thank you.
Sure.
It's been fantastic, and it's such a huge eye-opener with all the technology. And thank you for jumping onto this podcast to share with some of your experience with us.
Sure. I mean, if there's any question coming up in the future, let me know. Happy to answer.
Fantastic. Yeah, we will. We will. Thanks, guys.
Just wanted to say thanks, Derek. Really appreciate your time.
Thank you. Bye-bye.
That's a wrap on the T1Dialogues podcast. We've also got a YouTube that'll be coming out. We can see how glitchy Pete is through this interview. And please like, subscribe, and join the dialogues.
Sorry, guys. There seems to be a delay. I don't know if it's my connection or not.
Have we still got you, Pete?
Yeah, can you guys hear me?
Yep, we can hear you. You seem to be glitching a wee bit, but I mean, I've got Derek great, but you do occasionally glitch.
But it's funny, that Jackson and me living just on the other side of the world, it's no problem, And then Pete lives or is somewhere in a totally remote side in Australia.
Yeah, he's just in the next room. No.
Ah, okay.